Bismillahirrahmanirrahim. Today we are going to study about the Streptococcus pyogenes. It is a part of handwritten series of bacteriology. Let's start. So first we look at the position of Streptococcus pyogenes in the classification of Streptococci. So here comes the Streptococcus pyogenes, i.e. it belongs to the beta hemolytics and according to the speed classification, it belongs to the group A. Now we will further study about this in the lecture. Streptococcus pyogenes. There is a gram-positive cocci, and as I already said, this beta hemolytic, and according to lens speed classification, it belongs to group A. They have the same characteristics like Streptococcus that they are non-motile, non-motile, and non-spore forming. The habitat in which Streptococcus pyogenes lives is skin and oropharynx. Two important antigens are C carbohydrate and the M protein. C carbohydrate, according to which they are classified in a speed classification, and the M protein is the most important viral inspector, and it is antiphagocytic. It is antiphagocytic. Now it comes to the enzymes, toxin, and hemolysins, which are secreted and helps in the pathogenesis. For four enzymes are released by Streptococcus pyogenes. Hyaluronase degrade hyaluronic acid in the subcutaneous tissue and thus help in the spreading of Streptococcus pyogenes. Hence, it is also called spreading factor. Streptokinase, so it destroys fibrins in clots from by etc. by activating plasmin. The third one is the streptodornose or DNase is mainly used for diagnostic purposes as antibody develops to it in pyoderma. So in pyoderma, it can be used for diagnostic purposes. The fourth one is IgG protease, which is a protease which degrades the IgG and helps prevent opsonization and complete filtration, and thus antiphagocytic. It is antiphagocytic. Now going towards the toxin, exotoxin produced by focus by genes. They produce three kind of exotoxins: erythrogenic, pyrogenic, and exotoxin B. Erythrogenic toxin cause rash of the scarlet fever, and its mechanism of action is same. It is super antigen, cause release of interleukin 1 from macrophages, etc. And the most important point that it genes is present in the bacteriophage. This gene is present in the bacteriophage. Pyrogenic exotoxin, which cause toxic shock syndrome, and mechanism is same as superantigen. It acts as superantigen. A third one is exotoxin B, which is a protease and cause necrotizing fasciitis by destroying the tissue. Now the hemolysin released by Streptococcus pyogenes is streptolysin O and streptolysin S. Streptolysin O is oxygen labile, i.e. it is destroyed by the oxygen and cause beta hemolysis only on blood agar plate. And the antibody it develops called anti-streptolysin antibody helps in the diagnosis of rheumatic fever. Now streptolysin, which is oxygen stable and cause beta hemolysis when orally grows on blood agar, and it is not antigenic. No anti-streptolysin antibody will produced against streptolysin S. Now coming towards the clinical findings, it causes pyogenic disease, pathogenic disease, and immune-mediated disease. Pyogenic disease include laryngitis, skin and soft tissue infections, and endometritis. Laryngitis is most commonly characterized by fever and sore throat and resolves in 10 days, but if untreated, it can lead to rheumatic fever, arthritis media, meningitis, sinusitis. Skin and soft tissue infections include cellulitis, syphilis, necrotizing fasciitis, and impetigo. It also causes endometritis in pregnant women. It's also called puerperal fever. For the toxigenic disease includes scarlet fever, and it is due to the erythrogenic toxin, and it is characterized mainly by strawberry tongue. Second one is toxic shock syndrome, And the difference between the streptococcal and the streptococcal toxic shock syndrome is that the streptococcal toxic shock syndrome it has recognizable site of pyogenic inflammation and streptococcal has no such site. The second difference is that the blood culture is positive and in the streptococcal there is negative blood culture. Now, immune mediated, i.e., due to the antibody against N protein that react with human cells, cause diseases which are acute glomerular nephritis and acute rheumatic fever. Acute glomerular nephritis most commonly occur after skin infections and characterized by hypertension, edema of face and ankle, and has smoky urine. Acute rheumatic fever usually occurs 2 weeks after pharyngitis and characterized by fever, migratory polyarthritis, and carditis. Includes endometrium, myometrium, and valves. Now coming towards the laboratory diagnosis. So through microscopy, the smear is taken from wound and skin infection. We can see gram-positive cocci and can be diagnosed as disease caused by pathogens. But if we take the smear or pharyngitis from oropharynx, it is useless because viridins are a part of normal flora of pharynx and can't be this is can't be distinguished from the Streptococcus pyogenes. And this is useless. Culture to culture, we use nutrient agar and blood agar. Nutrient agar show leukoid in glossy colonies. Leukoid due to increase M protein and glossy due to decrease M protein. These both type of colonies can be seen. Blood agar show small translucent beta-hemolytic colonies. If they are inhibited by bacitracin, so it is confirmed that they belong to group A and it is Streptococcus pyogenes. Serological tests include latex agglutination test by detecting antigen in the throat swab specimen. Anti-streptolysin titer are high soon after group A streptococcal infection. If this is high, so that person can be suspected for rheumatic fever. NTTNS B titer are high, and if these are high, patient can be suspected for acute glomerular nephritis. Now coming toward the treatment, so for mild infection, penicillin G or amoxicillin can be used. And if someone is penicillin allergic, so then we use erythromycin and clindamycin. We can also use clindamycin with IV immunoglobulin for toxic shock syndrome and necrotizing fasciitis. That's all for today. Thank you, Zaki.